Thank you for joining us here at Doctor's Nutrition. I'm Dr. Jim.
And I'm Dr. Janine.
We're going to be putting together a series, and hopefully it's really going to be something that's very important for you. It's actually about how to prevent and reverse cardiovascular disease.
Yep. Cardiovascular disease is the leading cause of death in the United States. And 1 out of every 5 people will die of cardiovascular disease. So we deal with it on a day-to-day basis. We deal with it a lot. We've seen it worsen over the years. We have what we call a protocol that can help prevent and reverse. It's different from different people depending on what shows up on your lab work. Our big thing is looking at lab work first to see where are the issues.
Primarily when people come into us that know they've had cardiovascular disease, maybe they just had a heart attack or something, and you look at the lab work that they're being done on them by their cardiologists and so on, and basically it's not much. And they're checking their cholesterol, and they're always focused on cholesterol. And cholesterol is only one of the many problems you can have that will lead to cardiovascular disease.
Half of all people that have heart attacks have normal cholesterol levels. It's more than just cholesterol. And some people's high cholesterol isn't a problem. Some people's are. It really takes something called an NMR to look and see in depth. Where are your particles? What are the size of the LDLs? There's so many other things to look at other than just a total number. And unfortunately, insurance companies are more into illness. They are not into wellness. And we are into wellness. And so they won't pay to have these tests done.
That's true. So what we have to do is take a personal responsibility, so to speak, to say, okay, I want to know. And I'll be honest with you, my family history is not real good as far as cardiovascular disease goes. It's been something I've been concerned about really my whole life. And science has come out in the past 20 plus years, 30 years tops, and shown us a lot of really good insights into cardiovascular disease. And it's more than just cholesterol. The NMR that she mentioned about cholesterol, that's part of the kind of lab work that we do. We do a very inclusive, all-inclusive lab work for a person who wants to find out about their cardiovascular risk and or disease process. And it's called the Super Cardiac Panel. And it's going to have things in it that you've probably never heard of before, like oxidized LDL, homocysteine, C-reactive protein, things that you just aren't heard. And we're also going to look at things like your thyroid, your adrenals, the whole body.
The lipoprotein A, it's going to do the NMR I mentioned. It's going to do a lot of different testing. It's going to do an omega check to see what kind of omega-3s you have in your body. That plays a big role in cardiovascular risk as well. Now, we do all these tests together in our Super Cardiac Panel. And we do it. We don't deal with insurance because, again, like I said, insurance doesn't want to pay for the advanced testing, but we do it at a very reasonable cost. If you start looking at what those tests normally cost on their own, you'll see that our price for the Super Cardiac Panel is a very reasonable price. We do it not for a profit center. We do it so that we can see what you need to change that cardiovascular risk. Because without knowing what each individual person's risks are, you don't know for sure what that person needs to do for their risk factors. So whether you're wanting prevention or whether you're wanting to reverse plaque that you already have, we're going to go into detail on what each of those segments are and what we do to change it. So we're going to have different segments on each part of the lab work, and we're going to explain it and tell you what you can do for it.
Exactly. And I think that's the key. So if you join us along with this process, we'll take you from A to Z, so to speak, as far as determining your risk. And if you've got a risk factor, how do we correct it? And if you've got cardiovascular disease, you have, okay, is there a possibility of reversing it? We have about 28 years of experience with this, and we've seen quite a few cases where we documented it, where we could reverse some of these cardiovascular problems. So join us. I promise you it'll be a fun ride. We'll have a lot of really good information, and you'll learn a lot about the cardiovascular system and how to keep it healthy.
Right, because if you don't start somewhere, you don't want to wait until you have heart attack. And there's so many, 1 in every 5 out there is probably going to. So that's why you really want to do some stuff for prevention. If it's in your family, you want to start a little younger, then I say everybody by 50 needs to be looking at those risk factors. Younger if you have it in your family. In my husband's case, his family history is really bad. He is the longest living male in his family before him was 61, and he will be 77 next week. So he has lived way longer doing the stuff that we do every day than the rest of his family members. His brothers were 53, 58, and his dad was 61 when they had heart attacks that did kill them. So he has had a special interest in this, and I've had a special interest trying to keep him alive for all these years. So
it's been a challenge.
Exactly. So we do a lot. We eat differently. We do a lot differently to try to keep cardiovascular risk down.
And as we go along through this series, if we talk about diet, here's one thing you can understand. If we tell you that, okay, this is something you need to do in your diet, it's probably something I'm doing.
Right.
It's not something we just talk about and, pass the Dunkin' Donuts in the background, right? No. It's we live it, It's something as simple as making bread. Now, we do eat a little bread. We don't eat much, but we make our own. We grind the wheat berries. We make the flour. We make the bread. And, occasionally I'll have a little bit, but it's very little. And simply because of my risk factors. Now, your risk factors may be totally different. That's where you need to find out.
Right. And we're doing this series on cardiovascular risk and factors and how to, what lab work to do and what to do for it. But we're also doing a new segment on how to eat and videos. And so I'm going to be showing how we prepare things and how we cook for lowering cardiovascular disease. It is not your normal diet that you hear of no fat. It is good fat. And it's cooking differently, making things taste still good, still being able to enjoy food, because actually you want to be able to enjoy it. So you want to cook good food that you can still enjoy, but is healthy for you at the same time. Yeah. So we are going to be doing both of these segments coming up. So if you will, follow us so you can get a notification whenever a new thing comes out, and like us and send us to your friends.
Yes. Thank you so much for joining us, and we'll see you in the future.